This is Group 1, and for this video, we're going to show you the different examination of reflexes. Reflex is defined as an immediate involuntary motor response to an afferent sensory stimulus. Clinically, reflexes are of three types: tendon or deep reflexes, superficial reflexes, and visceral or sphincteric reflexes. The deep tendon reflex examination is part of the neurologic exam. Proper technique and interpretation of results are crucial to help in the diagnosis of many upper and lower motor neuron pathologic processes such as multiple sclerosis, amyotrophic lateral sclerosis, spinal cord injuries, spinal muscular atrophies, among others. They are sometimes referred to as muscle stretch reflexes. On the other hand, superficial reflexes are the reflexes which are elicited from the surface of the body. These reflexes are motor responses to scraping of the skin. These are initiated by stimulating appropriate receptors of skin or mucous membrane. These are usually multisynaptic or polysynaptic. Lastly, the visceral reflex. It's a reflex mediated by autonomic nerves and initiated in the viscera. Visceral reflexes involve a glandular or non-skeletal muscular response carried out in internal organs such as the heart, blood vessels, or structures of the GI tract. They utilize neurons of the autonomic nervous system to elicit their actions. Direct light reflex. A direct pupillary reflex is pupillary response to light that enters the ipsilateral same eye. Consensual light reflex. A consensual pupillary reflex is response of a pupil to light that enters the contralateral opposite eye. Accommodation reflex. The accommodation reflex is a reflex reaction of the eye when it focuses on a near object and then looks at a distant object, or vice versa. Convergence reflex. Convergence is a disconjugate movement in which both eyes rotate inward so that the lines of sight intersect in front of the eyes. Sneezing reflex. A protective reflex response. It is the expulsion of air from the lungs through the nose and mouth, commonly caused by the irritation of the nasal mucosa. Gag or pharyngeal reflex. The pharyngeal reflex or gag reflex is a reflex muscular contraction of the back of the throat evoked by touching the roof of the mouth, the back of the tongue. Jaw reflex. The jaw jerk reflex is a stretch reflex wherein the masseter and the temporalis muscles contract in response to the tapping of the lower jaw. Biceps reflex. An involuntary contraction of the biceps muscle of the arm produced by tapping upon its tendon. Triceps reflex, which is a deep tendon reflex, is a reflex as it elicits involuntary contraction of the triceps brachii muscle. Brachioradialis reflex. Type of reflex that strikes the brachioradialis tendon directly with a reflex hammer when the patient's arm is relaxing. Knee reflex, also called patellar reflex, a sudden kicking movement of the lower leg in response to a sharp tap on the patellar tendon, which lies just below the kneecap. Pendular knee jerk. It's an abnormal patellar reflex observed in patients with a lesion of the cerebellum, in which the leg continues to move several times after the initial reflex. Gendrasic's maneuver. The Gendrasic maneuver is a medical maneuver wherein the patient clenches the teeth, flexes both sets of fingers into hook-like form, and interlocks those sets of fingers together. The tendon below the patient's knee is then hit with a reflex hammer to elicit the patellar reflex. Ankle reflex. A reflex downward movement of the foot produced by a spasmodic contraction of the muscles of the calf in response to sudden extension of the leg or the striking of the Achilles tendon above the heel. Ankylosing. Clonus is a rhythmic oscillating stretch reflex. The cause of oscillations are related to lesions in upper motor neurons and is generally accompanied by hyperreflexia. Therefore, clonus is used as part of the neurological physical exam to assess the status of a patient's nervous system. Plantar reflex. A reflex movement of flexing the foot and toes that, after the first year, is the normal response to tickling of the sole. Abdominal reflex. It's a superficial neurological reflex stimulated by stroking of the abdomen around the umbilicus.